The Medical Research Council Gambia celebrated its 75th anniversary at the Sadauda Kairaba Jawara Conference Center. The President, His Excellency Adam Barrow, Cabinet Ministers and diplomats, joined staff to shine the spotlight on the achievements and successes registered over the last 7.5 decades. The Unit Director, Professor Umberto De Alessandro, spoke of the achievements of the Mrcg and its impact on the development of the health sector in the Gambia, with emphasis on human resources development through training and research.
This 75th anniversary provides the opportunity to look back at our history and celebrate some of the unit achievements and reflects on the way forward. It is a rich history, crossing several historical periods during which new ways of thinking emerged, new tools for diagnostic and treatment, and for disease control were developed. The unit has been and continues to be deeply involved in such development, with outputs that have had and continue to have a major impact on human health across the world, including the Gambia.
The unit enjoys household status in the Gambia. What Professor Liam Smith, the director of the London School of Hygiene and Tropical Medicine, describes as his incredible scientific contributions in the Gambia and the wider sub-region, which continues to grow to meet emerging challenges.
So the unit was established with an initial focus on nutrition, and it was quite a far-sighted, visionary, broad view of nutrition and wider health. And it's done amazing work in that area and done great contributions, but it's also successfully diversified into other areas we'll be hearing all about in the next few days, different vaccines and infections, including malaria, maternal and child health, and now really breaking new ground in new areas, data science, genomics, health and climate change. And it really does, this moving with the times and its ability to move with the times really does bode well for the future, I think.
The Minister of Health, Dr. Ahmad Lamin Samate, expressed gratitude to the Medical Research Council for its long-standing partnership with government in the development of the national health sector. This partnership, the Health Minister noted, has had a tremendous impact on the fight against malaria and enabled the Gambia incorporate trial vaccines in the expanded program of immunization.
The Gambia government Mrcg Gambia partnership, for example, enabled the first demonstration of the role of the insecticide-treated bed nets in the fight against malaria in the Gambia. And it is important at this juncture to note that the Gambia is at the pre-elimination stage for malaria. It also made it possible for the Gambia to be the first to demonstrate the role of hepatitis B vaccine in the fight against this disease, and the same for Haemophilus influenza type B and pneumococcal vaccines against invasive bacterial infections.
The President, His Excellency Adam Barrow, commended the existing relationship between the Gambia and the Medical Research Council, adding that its work over the last 75 years has made a difference in the lives of the people.
The development of this institution to become an internationally recognized center of excellence for research and training in West Africa, and its contribution to improving health across the world over these many years deserve celebration.
President Barrow noted with appreciation the Mrcg's collaboration with his government over the years, when the Gambia was declared free of trachoma, making it the second African country after Ghana to achieve such a feat. This, the President added, is just one of many achievements registered by the unit, thanks to its research and intervention in the fight against other diseases, such as malaria and liver cancer.
The impact of your research in collaboration with the Gambia Ministry of Health can be appreciated. When our National Malaria Control Program reported a 40% reduction in malaria incidents 10 years ago, and the successful clinical trials and incorporation of vaccines against liver cancer and invasive bacterial diseases such as pneumonia and meningitis, among other preventive vaccines.
President Barrow assured that government will continue to collaborate with the Medical Research Council into the future, whilst thanking the unit for its support to the Gambia. During these celebrations, the unit will organize a symposium to discuss its achievements and engage other stakeholders and partners on other topical issues to raise awareness on its activities and services in the Gambia. Mamadou Jallow, JRTS News.